1, 2, 3. Big push, big push, big push. Come on.
Is this your first time in an ambulance?
Yeah.
We're back on shift with the West Midlands Ambulance Service.
Let's go.
We are the lean, mean, blue light machine.
As the paramedics take us to the heart of every medical emergency.
You probably dislocated your shoulder.
We'll get you cleaned up on the ambulance, OK?
Trust us, we've got you.
The teams in green are back on the road in Dudley
I'm ready. Are you ready?
I've been born ready.
and are primed for action in Stoke.
It's like an Alfred Hitchcock murder scene in there.
Here, the crews face life and death decisions.
You've got no pain in the top of your back.
This is cardiac. We're going to go a little bit quicker than normal.
Giving you a paramedic's eye view of every challenge.
I can hear her. She's shouting help.
What was that?
1, 2, 3.
999 mode activated.
Body-mounted cameras capture every moment as they battle around 4,000 calls each day.
You called for an ambulance?
I'm gonna need a dressing, mate, because that's leaking.
It's looking like a hoax.
On what planet is that amusing?
Showing you what goes on behind closed doors.
Hello, ambulance.
You'll be on the front line with them as we take you inside the ambulance.
Let's get you sorted, shall we?
I've heard that you were a fussy eater.
Very fussy, very.
What's your diet then?
So, I'm not a fan of roast dinners.
Right, well, we've fallen out already. Carry on.
I don't really do vegetables. I'll eat them if I have to. In front of the kids, I'll eat them. Just carrots and broccoli.
Right.
Broccoli occasionally, but carrots only if they're cut round and overboiled, so they're a little bit soft. I can't eat them in strips because they're just horrible.
It's the same thing.
Yeah, they just taste crunchier.
Right, here's a question for you then. On a night shift, when you're hungry and you're just craving some naughty food, what's your go-to?
Like mac and cheese.
Is it?
Or carbonara.
Mine is a dirty kebab.
So I don't like kebab.
Do you not?
No.
Oh.
Oh, an ice cream man.
Oh, yes.
Oh.
What would you have first, cream man?
Oh, I'd have a Knickerbocker glory.
Oh, OK.
In Dudley, former nurse turned paramedic Jo Stevens is on the road with her crewmate Jason Mitchell, a technician who has 18 years' experience with the service.
Why can't we have a nice transfer to the coast or something?
It'd be nice, wouldn't it?
Then we can have fish and chips on the beach.
Stop off on the way and pick up our costumes.
Oh, I tell you.
You mankini.
I'll go in as I am. Take my uniform off, boom, I'm in.
Their next job has just come through.
We're going to a female, 66 years old, facial injuries following a fall. Patient's still on the floor. Clinical GP request.
I wonder if it's an off-duty or just by the doctors or something.
Passing doctor.
Yeah.
It's one way getting an appointment with the GP.
Widow Carol has had a nasty fall on a very busy road. Concerned passers-by called 999 and are waiting with her.
Here she is.
Hello?
Hello.
What's happened then?
I was just driving along this way and I just seen a line on the floor, so I just quickly jumped out. Good call, I got some type from my nose, or from my cheeks and everything. So I just got loads of tissues, and then obviously these are the people who come along and helped.
Sorry, I'm looking at the GP, so this is your game in. I've not taken this off the place, so I'm told to keep the pressure on, keep upright.
Yeah.
Pulse seems pretty steady when I checked it, but I've done nothing else.
Is it Carol? Right, Carol.
Hiya, Carol. Let's have a feel down the neck first.
Any pain when I'm pressing, Carol?
Just keep your head steady, just answer yes or no if you can. Anything here?
Right. Have you got any pain anywhere, Carol?
Yeah.
Your head? All right. Let's just have a little look at this tissue a minute, my darling.
Just need to have a look at it, Carol. All right, Danny.
Oh, don't wipe it yet.
Don't wipe it yet. Oh, bless you.
Do you know what happened? What happened? What did you fall over? Just tripped and fell. Did you put your hands out to try and stop you? Yeah? Oh, is that sore there? All right, my darling.
Any pain in your hips or legs, Carol?
I suffer with my hips. I've got arthritis.
You've got arthritis in your hips. Any other medical problems?
Diabetes.
How do you control your diabetes?
Injection and tablets.
So you're type 1 diabetic, yeah?
2.
Type 2, okay. We'll have to pop you to the hospital.
Don't blow it. Don't blow it. Any clots that are forming in there, we need to keep them there, all right? Because that'll stop the bleeding. Right. Ready, steady, stand. There we go. Carol, just sit on here for us, sweet. Swing your legs up for me. You're all right. It's okay. Accidents happen. Right, we'll get you cleaned up on the ambulance, okay?
All right, I'll have to leave you to it if that's all right. I've got to head off. That's what it's nice. Thank you.
Thank you. Bit of a bump, Carol, all right?
That's everything she had with her.
Lovely.
I hope you're okay. Thank you. You're welcome.
Oh.
Anytime.
Any kind of fall's a horrific experience for anybody, especially when you're out in public with people watching.
That it was lovely that people passing by had actually stopped to help her. One person actually took the coat off and put it under her head as a pillow.
I'll be like to work.
Where'd you work?
Cleaning.
They're going to have to find somebody else to clean for today, aren't they? If you open your eyes, Carol, can you see out of your eyes all right? No problems with your vision?
No.
Were you rushing to work?
No, I'm not rushing.
Joe's going to give you a facial.
I'm going to clean your wound up a little bit just so we can have a closer look. You've got a lovely bit of swelling around the top of your eye and a bit of a bruise. I just want to try and clean the grit out.
A bit of a black eye, isn't it?
Yeah.
It's a bit tender, Carol.
I feel like I've been at my house.
You're not on blood thinners, are you?
No.
Have you had your diabetic medication this morning, Carol?
Yeah.
Yeah. What do your sugar levels normally run at?
I've been all over the place because I've not long had pneumonia and it went.
Okay.
You've been in the wars, haven't you?
Oh, tell me about it.
As Carol's blood sugar readings are normal and not the reason for her fall, the crew need to try and find out what did cause it.
You all right? Oh.
Don't get upset.
Do you have problems with your balance at all, Carol? You do?
Well, you got vertigo.
No, I nearly broke the corner.
That's better than any joke Jace ever comes out with.
You've never been diagnosed with vertigo or...
Yeah.
You have? Are you on any tablets for your vertigo? No? Okay.
Dizziness can be a sign of numerous things, including low blood sugar, high blood sugar, inner ear infections or vertigo.
There is a possibility that Carol could have had concussion as well due to the severity how she hit her head on the pavement.
I'll jump in the front, Jace, all right? See you in a bit.
At least people stopped and helped and you had a GP
Yeah,
as well.
lovely was that.
How you doing?
Sick as a dog.
quite normal after a head bump though. You ready?
Now at Birmingham City Hospital, Carol will be taken to the emergency department to be assessed.
All right. She's done herself a good injury there though. She's going to have a lovely black eye for a while.
Oh, God, yeah.
Nice of that doctor stop though.
Yeah, really nice. There's not many people doing them.
And lucky it wasn't any further in the road as well.
Well,
Really lucky, because that was a really busy road. Let's just hope it is just a superficial bump and a cut. And there's nothing else.
but she was in good spirits,
She was, bless
wasn't
her.
she?
Morning, policeman.
Hi! Nothing! What's wrong with them? Honestly.
Have a good wave, I do. It depresses me when they don't wave back.
What's your signature wave?
Mine, over.
Yeah. Which one? Should we do it together?
Yeah.
1, 2, 3.
In Stoke, Sam Smith, who's been a paramedic for 2 years, is on the road with crewmate Nick Griffiths. Before Nick trained as a paramedic, she was a swimming teacher.
The best bits about being a paramedic is having the skills to help people. I especially like going to the elderly people and helping them when they need us. I love my job.
Right, so we are going to 83-year-old Arnold. Short of breath, he's been struggling for a few days with COPD. He's currently on his own, but his son is en route.
999 road activated.
COPD stands for chronic obstructive pulmonary disease, a blanket term for lung conditions that cause breathing difficulties. In the house, widower Arnold is in some distress. His son Carl is with him.
Hello, sir. How are you? So my colleague will be in just a second. I'll just have a feel of your wrist. Tell me what's going on. Relax your hand for me, sir.
For a few days I've had this breathing, and other times it's gone on. It's it's gone all right. But this time it's.
So it's keep getting better and then going worse again.
Yeah, but anyway, it's gone. Last night was really bad, and I thought, well, I'll ring the doctors this morning. But they said no, I must
call us.
Call paramedics.
Hi, Ducky. My name's Nick.
It's been like the last 3 days he's been coming and going.
Just keeps having like a float. Any chest infection or anything like that? Or?
Well, that's why I wanted to go to the doctor to see if he had a chest infection.
I thought the doctor would have just seen me, but he said...
If your breathing's a bit too bad, then they'll want us just come in case we need to get you up the hospital or anything, OK? You got COPD, is that right?
You got a big box of meds in it.
OK. Have you got any inhalers?
Yeah,
I've got two. I've got the blue one
Yeah?
and the brown one. One I
Ooh.
take.
Are your hands so cold because you've got such a warm heart?
No, really.
Now, blinking heck, how tight are these? You got your Spanx on?
Yeah.
You dressed for winter.
To keep older patients calm, I do like to draw on my sense of humour and have a bit of banter. I don't think you could ever go wrong with that.
I think it's more of an infection then.
Quite a bit of wheezing. Have you had a nebuliser before?
Yes.
Going to stick you on one of them. Can you say 99 for me?
Yeah.
99.
99.
And again.
99.
All right, lovely. So you've got quite a bit of wheezing in your chest, and at the bottom of your lungs, you've got some quite thick mucus there. Okay, so it probably is looking like a bit of a chest infection or something. Yeah. But you're putting a bit of effort into your breathing as well, because you're breathing quite quick and you're using some extra muscles. It's just your body's where you're trying to get more oxygen in when you're breathing. Okay, it'll be with you having some rubbish at the bottom of your chest. Right, let's put this on for you. Watch your glasses, don't ping them off.
Arnold hadn't called us for a few days, even though he'd been feeling breathless. I don't think he wanted to bother us, really.
To suffer with COPD and get to that age and find it so difficult to breathe, it must be so frightening.
Right, nice and still for me then. Your oxygen levels are 100% now. Now you've got that nebulizer going.
Yeah.
Blood pressure is quite high though.
So I know my blood pressure normally. Probably panicking a bit, you know.
You don't have panic with us. I do think you need a chest x-ray. Okay, the last thing we want is pneumonia or anything like that cropping up. So may just have caught it before it starts getting
any worse.
Yeah, that's why we need to sort of get on top of it and that now and then you can get over it.
The crew need to take him off the nebulizer to get him into the ambulance. But they'll have to do it quickly to make sure Arnold's breathing remains stable.
Just go nice and steady. We're going to put you back on that nebulizer in a sec, okay?
Give you a second to catch your breath.
Yeah.
Thank you.
The quicker we can get you in the ambulance, the quicker we can start you back on the treatment, okay? To help you.
Okay, I'll meet you up in the hospital then, yeah?
Yeah.
Tell me when.
1, 2, 3, ooh.
Right then, darling. Bottom on there, in that crease, okay?
Yeah.
Load on chairs, aren't they? You can pop your feet up. Don't worry about your slippers, we don't do the washing.
Blankets.
Have a rest, I haven't slept all night, so have a rest.
You go for it. Have they kept you awake, your breathing then?
It's all right, if Nick keeps talking to you, you'll soon fall asleep.
It's lovely, isn't it? When you work with lovely people. If it ever gets like this again, or even not as far as this.
I shouldn't have let it go this far.
No, you ring us. Don't worry about the doctor, just ring 999, okay?
You don't put people to trouble, you know.
This is our job, this is what we do. If it wasn't for you, I wouldn't be able to feed my kids.
I bet you kept busy anyway, aren't you?
We are, but it's worth it. Have you lived a long year long?
Oh yeah, 40 years nearly.
Have you?
Nearly 40 years. I was worked on the buses for 40
Oh,
years.
did you?
Bus driving,
I
yeah.
said my granddad used to work on the buses.
Yeah.
I bet it's a nice job though, isn't it? It's a bit like us, but unfortunately we get to see people when they're poorly, so we can't always have a chat and a laugh and a joke and that, but...
I enjoyed it. I
Yeah.
think what spoiled it was when they took the conductors on.
Yeah. It's how times change, isn't it? And
Yeah, I'm afraid so.
cost cutting.
Thing is, I know, every day's different, isn't it?
Yeah.
Same as you never get 2 days together
No.
the same, do you?
No, definitely not. How are you feeling now? Compared to sort of a few hours ago?
Yeah, a lot better, thank you.
A lot better. How long ago did your wife pass away?
It's 4 years.
4 years. Oh,
Yeah.
I'm sorry, sweet. It's horrible, isn't it?
Yeah, she,
How long were you married for?
60 years.
Blinking heck. So you're used to each other then?
Yeah, just about, yeah, yeah.
Bless you. I haven't met my soulmate yet.
You haven't.
He's out there somewhere.
He would come to you one day.
Right. People keep saying that.
Yeah.
I think he keeps walking past. You survived with me, haven't you?
Yeah.
You coped.
Yeah, we put the world to rights, haven't we?
Oh, always got to do that.
At Royal Stoke Hospital, Arnold will need a chest x-ray to check whether he's suffering from an infection or has developed pneumonia.
I can hear you having a good natter in the back.
Yeah, he's lovely. Really nice bloke. But it's amazing though, you know, again, I don't want to mither anyone or put anyone out. It's like if you can't breathe, ring us.
In Dudley, student paramedic and keen surfer Liam Pearson is on the road with paramedic Luke Adams, who lives with his mum, dad and 3 dogs.
You could live anywhere in the world, where would you live?
Vancouver.
Reasons?
Good quality of life, good infrastructure. Canada's just a nice country in general.
And huge.
Yeah, massive, yeah. I just don't like bears. Imagine, like, sleeping out in the wilderness and you just wake up to a bear poking his head through your tent. That's a bad day, isn't it?
It's 7 a.m. in Stoke.
Were you on days yesterday or not?
On days, yeah.
The shift has just begun for paramedic Tom Bradfield, who's been working for the West Midlands Ambulance Service for 5 years.
So I love the job. The little kid in me would say driving around on blue lights and sirens is the really enjoyable part of it. But the actual adult in me, it's the helping people, making difference to people's lives.
He's teamed up with Tom Castle, who's also been with the service for 5 years and has just become a first-time dad to his little girl, Alicia.
Did baby keep you up last night?
She was actually, last night was fine, but I was up at 5 yesterday morning. I'm just tired.
They've received their first call of the day.
So a 20-year-old with difficulty breathing and chest pain. The majority of times when you go to people at that sort of age that have got chest pains, you normally go, oh, it's a respiratory problem that's causing the chest pain, not a cardiac because of their age.
The patient is 20-year-old student Jordan. The crew arrive at his house within minutes and are greeted by his mum.
Hiya, morning.
There we go in. Oh, yeah.
Hello.
Hi, Macy.
I'm Tom. This is
I'm also Tom, so you can't get our names mixed up, OK? It's nice and easy. So what's been happening?
A lot of trouble with my chest for ages.
Yeah.
Yeah.
And I've been I had to go for the camera down a few weeks ago.
So did you have an endoscopy, did you? Yeah. So what's been happening this morning then?
I was waking up in the night, and then this morning when I woke up, as soon as I woke up, my chest went dead tight. It sat on the floor for about 10-15 minutes being sick.
OK. Were you actually vomiting? Oh, yeah, you were. OK, what were you bringing up?
Food thing.
All right, we'll do a few checks on you. So whereabouts is the pain at the moment?
Yeah.
It's there. OK, just on that side. Does it go anywhere else at all?
Just like in the middle.
In the middle. OK. All right, have you had it before?
Not as sharp, but I've had the pain before, yeah.
OK. What we'll do, we'll just make sure your heart's OK. We'll do 12-lead ECG, so it just means I've just got to stick some dots across your chest. Yeah.
We start with worst case and
we'll work
sort of work our way backwards.
So you haven't had the results back from endoscopy yet?
Just what it says on there.
You've just got esophagitis and acid reflux. You've got grade B esophagitis.
Jordan's been diagnosed with esophagitis, an inflamed esophagus or food pipe.
Esophagitis on its own is quite manageable and you can deal with that day to day. Long term, it could lead to ulcers.
It's most common in males aged between 30 and 50 and caused by acids from the stomach. Jordan's already been prescribed tablets by his doctor.
You are taking those, aren't you?
When did you last take these?
I've only took one yesterday.
How long have you been is that the first time you've taken them?
I've not. I picked them up like about a week ago.
And have you been taking them for the week?
No, not for the week. I had some other ones left from before.
The condition that you've got, which is esophagitis, is to do with like acid reflux and things like that. That will
basically
reduces the acid in your stomach, but also reduces the chance of getting the acid reflux as well. So it's a case of taking them morning, so it's twice a day. It's normally taking 12 hours apart.
What I need you to do, Jordan, is just relax back into the chair and just stay nice and still for me, that's it. Just while I do the ECG.
How would you describe that pain? Stabbing?
Dead sharp.
We were pretty certain as a crew that the pain that Jordan was experiencing was down to his esophagitis. The location of where the pain was and the fact it wasn't radiating, which cardiac pain would most possibly do.
Just relax for me again, Jordan. I'm just going to do your blood pressure again, OK? It's just going to go tight on your arm. I'm just going to do another 12 lead now. His heart rate's a bit higher. So it's back to normal now.
The crew's tests on Jordan indicate that the most probable cause of his chest pain and vomiting is his esophagitis.
Had Jordan taken the medication, the chances are that the pains that he was feeling would have been either completely alleviated or significantly reduced. So actually the medication is there for a reason. Those tablets, take those regularly.
Even when you're not having symptoms, any symptoms, just keep taking them.
Spicy soup. Do you eat a lot of spicy food? Yeah, no spicy foods.
Yeah, try and avoid, like, really sort of fatty foods as well. So if you're having, like lots of cheese, for example.
What did you have for tea last night?
I had pizza.
That can also cause you to get acid reflux.
You're probably best to go back to your GP. Yeah. It's more likely that it's going to be something to do with your gastrointestinal kind of problem rather than a cardiac issue is what we'd be worried about. As I say, everything's ticking up normal for us, so honestly, if I thought you needed to go to hospital, we'd be taking you.
With a cardiac problem ruled out, Jordan will be staying at home today, but he must be more aware of his acid reflux issue.
Nice to meet you.
All right, nice to meet you. You take care, won't you?
You're OK.
In Dudley, regular crewmates, paramedics Lottie Stubbs and Ben Fletcher are on shift together as usual. But Lottie's day started a little earlier than Ben's.
Got up early this morning to start cooking us some lunch for later.
Yeah. Oh, now I'm listening.
So,
What we cooked?
we've got sweet chilli chicken thighs. And we've got some rice with that.
Oh, perfect.
For why not?
You've made my day. Made my day. We work really well together. Outside of work, we get on really well. 3 years in, and had an argument.
No, not even at work?
No. We can do 12 hours at work and then go straight out afterwards and carry on having a good night as well. So it's naturally we just get on and it shows at work.
That's it, I forgot the veg.
Charlie 1 call, please. Report someone choking.
Yeah, received a mobile, thank you.
A Category 1 call comes in. Someone has phoned about a choking child.
It's come from the police. I'm part younger child on call, requested police. Heard a child advised baby choking, cleared line, please call back. Part, no details, just location. That's it.
For a baby?
Yeah. In a situation where a child's choking, it is very urgent that we get there soon because within minutes that child's going to not be able to breathe at all and it will turn into a whole different situation. Obviously we'll have to see what size the child is, how old they actually are, in order for what position is going to be best for this kid in order to get the object out.
Yeah.
It's come from the police. I'm part younger child on call, requested police. Heard a child advised baby choking.
In Dudley, paramedics Lottie Stubbs and Ben Fletcher are responding to an emergency call made from a phone box.
Police called back, but the line's ringing out. No part details, just a telephone kiosk.
The police have been trying to get them more details, but there's been no answer from the phone box where the emergency call was made.
Makes you question it, doesn't it? If this is a hoax call, I'll be fuming.
Actually, both stopped in the same places, well done. Honestly.
Okay, so straight over. Just
right here. Right, and then it's on the left. Should be a telephone box here somewhere.
One there.
Hello, mate. We are by the telephone box that I believe the call was made from. There is nobody around here. There isn't any parks either. There was one a bit further up which had like a funfair on, but we're at a bit of a loss of where this potential choking child is. Are you all right just to ring the telephone box and see if it is that one?
Okay, on your standby.
While Lottie waits for the call, Ben searches the immediate area.
Hello? Yeah, that's fine. 95, yeah, that was the telephone number that's phoned us. There is nobody around here.
A local resident tells them that some children were hanging around the phone box before running off.
Which way did I go? It's right there.
But that phone definitely rang, yeah?
Yeah, it definitely rang.
We got the right one then? Bear with.
Thanks, mate.
That chap just said there was a group of kids about 20 minutes ago around here. And they've gone off to the shops down there.
So it's looking like a hoax then?
Hoax calls are probably one of the most frustrating parts of our job.
I don't know why people make hoax calls, especially not to the emergency services, when we are there to help people and make a difference. It's heartbreaking. You get a horrible feeling in your stomach to have been misled like that.
Oh, frustrates me, it does. It really does. Who thinks it's funny to ring up and say a baby's choking? On what planet is that amusing? You know.
Over the past 5 years, the West Midlands Ambulance Service has received over 5,000 hoax calls, wasting countless hours and costing around £40,000.
You know what, someone else could have needed this ambulance. And these kids have took that away from someone.
Yep.
Absolutely ridiculous. I don't understand how they don't understand how serious it is to make a hoax call and that it can actually impact on someone else's life.
We're like work brothers, apart from one's better looking than the other.
Don't be harsh on yourself.
What did we get called the other week?
What did we get called the other week?
Gorgeous?
Was it gorgeous?
Hot.
Hot. That was it, hot.
Smoking.
Yeah, I really didn't know how to react to that. I don't think I've ever been called hot before.
No, definitely not.
In Stoke, paramedic Sam Smith is back on duty, this time with technician Dino Gould. They're both sporty lads. Sam likes to play football, while Dino prefers ice skating.
Oh, hey. Got a job.
999 road, activate.
A2, yeah, thought so. Trauma case. Unknown patient, but she's female. Although that could mean nothing. I walked into a female patient named Derek before.
Yeah, I did that the other day.
I did ask just in case.
Called Alan, yeah.
The crew have been sent to see 82-year-old Mary, who's recently been widowed. Mary has fallen and hit her head. She activated an emergency call after pressing the pendant she wears around her neck.
Hello? Ambulance? Where are you? In the sitting room? Where are you in the sitting room? Oh, hello. How are you?
Well, I've been dizzy yesterday and today. This morning I got up and I went to put my eating off in the central eating off, you know, that's it. And then I just went backwards and I hit my door drum right at the top of that.
Well, just, I'm Sam, by the way, this is Dino.
Hello, sweetheart. Hi.
So you've hit your head where, sorry? On the...
Door drum at the door.
On the door?
Yeah.
Oh, OK. In the bedroom. And how have we got here?
I crawled.
Crawled here. So do you remember the entire thing? Did you get knocked out at all?
No, I didn't.
No loss of consciousness. Right. So whereabouts did you bang your head? Just on the back?
Yeah.
I'm gonna have a poke. Where the lumps are?
No, where the lumps are.
Any pain as I'm pressing?
Not particularly. I'm not And a lot of pain, but I'm just...
Does that hurt where I'm pressing?
You know. No, it doesn't hurt.
And what if I come down your back like this?
No, I can't.
Can I just get you to lean forward just very slightly? That's fine.
I was only telling daughter I ought to go to doctors yesterday.
Yeah.
I've got like to a toothache, you see.
Just cold, sorry. What do you suffer from?
I'm suffering from nerves a bit.
From your nerves? Okay.
Tension, you know.
Anything else? Do you have any problems with your breathing?
No.
Any problems with your heart?
What does it know?
Are you on any medication at all?
Yes, I've got a pack in the kitchen.
In the kitchen. Can I go, or is it all right if my colleague goes and gets it?
Yes, it's on top of the red bin, I think. The last meal's been in November.
Oh, did you? How have you been since then? Has it been hard?
And it is a bit, it is hard.
How long were you together for?
63 years.
63
if it
years.
had been on the fortnight, it's been 63 years.
When somebody is widowed after a long time, they do find it hard to adjust. Sometimes they often lose their confidence if they've been through that kind of trauma. It's quite sad.
A blood pressure test is a standard observation for the paramedics, but Sam is concerned about Mary's reading.
So you're known to have high blood pressure, but you're not medicated for it?
I don't know, not if it hadn't been there.
Not that I heard, no.
That's all I take.
Because your blood pressure at the moment is really, really high.
Is it?
Have you had all your medications as you should?
Yeah, well, I haven't had this morning yet, have I?
No, because you've been dancing around on the floor.
Yeah.
So you feel unsteady yesterday?
Yes.
So your symptoms could be caused by a high blood pressure.
For the over 80s, the target blood pressure reading is below 150/90. Mary's was 218/134, worryingly high.
With Mary, with the blood pressure being so high, we needed to take her down to A&E. She wasn't too sure herself if she was on any blood pressure medication, so we needed to make sure that she got seen and it got treated as soon as possible, because it puts her at a much higher risk of heart attacks and strokes.
Right, shall we get you up? Use that hand, mate, yeah. We're going to use the sofa to give us a hand.
Yeah.
So if we get onto your knees, because then this means you can pull yourself up.
Well done there, sweetheart. You're doing brilliantly there, Mary. You've done that all yourself, sweetheart.
Yeah, I'm not even helping. See? Brilliant job. Hiya.
Mary's daughter arrives, having been alerted by the emergency call system.
Hello.
Hi.
What you been doing?
She's been doing cartwheels on the floor and all that.
It's very unsteady yesterday.
She's not been able to get herself back up, but to be honest, we've got her onto her hands and knees, and I think it was just more confidence. We've been either side of her, and she's got herself onto the chair, which has been good. However, what I was just about to talk to you about is your blood pressure, sky high, dangerously high, and it could have caused the symptoms you've been having. Your dizziness, your unsteadiness on your feet, that can all be caused by that. So I'd like to take you down to A&E to get you checked over. I know you don't want to go, but it's what we would recommend.
You need to go. You need to go, and I'll follow them down.
I don't want to take you. I'd rather leave you at home if I could, but it's just not. It wouldn't be safe for you.
Well, last thing we want is you having a heart attack or a stroke if there's something they can give you to bring your blood pressure down. That's the easiest thing, isn't it? And get you checked out.
Just I'll have to change my chocolate.
Oh, I wouldn't bother about that. I can do that if that's what you're worried about.
You're going to go for the full ball gown look as well?
Strap you in case you go too fast.
I need to strap you in because I'm driving.
Terrifying, trust me.
Only passed my driving test last week.
No, it was the week before. Let's see if we come up or down. Righto, mate.
Good to go.
Good to go.
During the 38-minute journey to the hospital, Sam keeps an eye on Mary's worryingly high blood pressure.
Yeah, we're still very high. 236/141. That is very high. If they don't have to, they won't. But I don't know exactly what they'll do. I'm not going to start spouting a load of things because I'll just be fibbing to you. Okay, so you'll know when you get there. Okay.
How you feeling, Mary? Not so bad. Has he been looking after you?
Yes, yes.
Had a bit of a natter.
Jolly
haven't we?
good.
Ready?
Let me hold that drink for you. That's it. You're all right, Flower. You're fine. We've got you.
At Royal Stoke Hospital, Mary's blood pressure can be thoroughly assessed and treated by the medical team.
I tell you what, I've not seen the blood pressure that high for a while.
No, she was really going through it with that blood pressure.
Oh yeah,
wasn't
she didn't do things by half.
X-rays on Carol, who had a fall in the street, showed she hadn't broken any bones and there was no sign of concussion. Her vertigo and diabetes are now under control, but since her fall, she's been having trouble with her eyesight and has been advised to see a neurologist. 83-year-old Arnold, who was having trouble breathing, was diagnosed with a chest infection. He was sent home the same day with medication, steroids, antibiotics and a spare inhaler, and he's now feeling much more comfortable. 20-year-old Jordan made an appointment to see his GP later that day and was prescribed more tablets to lower the amount of acid his stomach makes. Unfortunately, he's still in some pain and his condition hasn't improved. Widow Mary, who fell and hit her head, was already taking low-dosage blood pressure medication. She was advised that the dramatic spike in her blood pressure could have been caused by the bang to her head. Her medication was increased and she was sent home. She's now taking a lot more care when moving around.
Thanks for a good shift, mate.
Yeah, cheers, babe. It's been a good day. So I'm more than happy to work with you again, so that's fine. Don't worry about that. You've passed.
Oh, I've passed. Out of 10. What would you give me?
Oh, I'll let you know about that.
Oh, is that, they have to wait for that?
Yeah.
Laughter is, of course, the best medicine, but I think I'd need something a little stronger. One Born Every Minute is here at 10. Before that, the 999 Rescue Squad have a real tough job on their hands next here on W.